What's going on, guys? Welcome back to the channel. My name's Dr. Vincent Esposito, and today we're going to be talking about dairy and lactose intolerance and how it could affect your health. But before we get to that, if you haven't already, please subscribe to the channel. I'm coming out with videos twice a week on everything from health, nutrition, wellness, longevity. So if you're interested in any information like that, give some of the videos a listen, and hopefully I'm able to help you in some way. So to start out this video, I want to talk a little bit about lactose intolerance and what it is exactly. So lactose intolerance, the name itself, is a little bit of a misnomer. Instead of a true intolerance, it's actually just a deficiency of enzymes known as lactases. Now, lactases break down lactose into its two monosaccharides, one galactose, one glucose. So basically, when these lactases are present, when they're found near the intestinal walls, they're able to break down lactose into these two sugars, and you don't really have any symptoms going forward. Like, all is good, no harm, no foul in this situation. However, problems can occur if we don't have those enzymes or we lack enough functioning enzymes to break down this lactose. And this tends to happen when we age, and I'll get to that in a little bit, but this is when you get those symptoms of bloating, gas, diarrhea, even autoimmune. It could be an autoimmune trigger since most of the immune system is located around the gut. So this is where dairy and the problems that come along with it begin to arise. Another difference between the inability to digest lactose from other intolerances is that if you don't have the enzymes present in the small intestine, lactose molecules end up moving into the large intestine, where they are then fermented by bacteria. And this is where you might get some of those symptoms like the gas and bloating, because these bacteria are literally fermenting lactose molecules now in their home in the large intestine. Now, interestingly, as humans, we actually are for the most part, all born with enough lactase enzymes to break down lactose. And this makes sense, since we are born to essentially consume a mother's milk. But however, by the time we reach adulthood, almost 75% of adults worldwide lose the ability to effectively digest lactose. Most people who are still able to digest lactose actually reside in Northern European countries, America, and Australia. Although it still happens to a lot of people. In fact, about an estimated 25% of Americans lose the ability to digest lactose after weaning. Now, in terms of the ability to digest dairy at all, we maintain somewhere between 10 and 15% of these lactase enzymes, the number of them, compared to when we were infants. So our ability to digest small amounts of dairy still exists. However, now it has become such a major part of our culture, especially here in America, that these aren't in small amounts anymore. And they are having detrimental health effects when we're having such high amounts of them. For example, in a population study done in Sweden of over 100,000 people over about 20 years, found that in women specifically, they were more prone to bone and hip fractures as well as heart disease when they consumed more milk than those who didn't. Men were also at a higher risk for prostate cancer, and both among men and women, they were more destined to a premature death if they consumed higher amounts of dairy than those who didn't consume dairy at all or in lower amounts. Similarly, people tracked in Finland found that when they cut their butter consumption by 75%, what resulted was an 80% decrease in mortality from heart disease. This was reflected in the fact that many of their cholesterol and blood lipid panels tended to improve. And this was actually due to a countrywide effort to reduce the amount of dairy products consumed on a regular basis, which is actually very positive to hear. One of the problems with dairy products, and really all animal products in general, is that they contain exogenous hormones such as estrogens and other steroid hormones. The hormones found in milk, for example, are associated with increased prevalence of puberty, male reproductive potential issues, and even premature puberty, which may explain why women who consume dairy are 5 times more likely to produce twin births compared to those who do not consume dairy at all. When it comes to cancer, particularly hormone-dependent cancers, things like breast cancer, ovarian cancer, prostate cancer, for example, researchers find that the added hormones could lead to the propensity of these types of diseases. And this is found in certain studies that have evidence suggesting that dairy consumption can help convert precancerous lesions into cancerous ones in vitro. Dairy consumption can also play a role in increasing the risk of asthma, Parkinson's disease, and increased blood pressure. So at the end of the day, what does this all mean? Generally, when people tend to eliminate dairy, a lot of autoimmune type conditions tend to improve to some extent, if not get a lot better. Also, other symptoms, we've seen how it decreases the amount of saturated fat, which also may help improve levels, say like blood lipid levels or heart disease markers, which is really important to our health overall. Now, that isn't to say a little bit of dairy on occasion for most people would not be an issue, but for those who are particularly sensitive to dairy and who most likely do not have those enzymes, as we said, most adults tend to not have them, eliminating dairy altogether can be really, really helpful and generally a good place to start if you're looking to really improve your health going forward. And like I said, with the added hormones, with the other links it has to certain types of cancer, particularly the hormone-dependent ones, it can really make a big difference. So I hope you found the information helpful today. Again, if you have any questions, if you want to know more about it, I'm happy to chat about it in the comments. So feel free to leave some info there. I'm happy to keep this dialogue open. If you did like this information, please like and subscribe below. Coming out with videos twice a week and really appreciate, any support I can get. But until then, take care, guys.